today's my day off, and I I thought, why not? Like, we can have a live session, right? And ask some questions, basically, right? So just 30 minutes is okay, or as long as we can go, folks, is totally fine by me. Totally fine by me. Totally fine by me. Okay, guys. I will be entertaining questions, any form of questions with regards or with relations to sexuality and, of course, health as well. I am Noskamsia Norma. This is Sexuality and Health Wellness. We talk about everything with relations to sexuality and, of course, health. And here is the drill: we leave no crumbs behind. Welcome to this live. This is Sexuality and Health Wellness. And of course, I am down to take your questions on issues with regards to sexuality. If you're joining, let us know where you're joining from and drop your questions on sexuality. Whatever your question is, you can drop your questions on sexuality, okay? Yesterday we had a few time. Yesterday we had a wonderful time. Our live session was sleek. Okay. So yesterday we had a lecture on our live chat. Okay. I kind of love a situation where I'm talking and I'm getting that response, that kind of thing. So we had this live session, but it was basically teachings. Although after the teachings we had questions, of course. We had questions after the teachings. I enjoy it when I when there are questions for me to answer. Okay, so and the fact that I am doing this humanitarian services, it makes me much more happy because giving people knowledge is it's a human thing to do. I mean, it's human standing for humans. So what do you think? I mean, what do you know? So that is it though. That's by the way. So yesterday was really awesome. We spoke about a very interesting topic. Some people joined, and from joining, some people even have to subscribe, telling you how important the topic of yesterday's live was. So yesterday we spoke about the G spot. We spoke about different things about the G spot, and of course we had a rundown of where it is found, the location. We had a rundown of the process of stimulating the G spot, which is totally something, a knowledge that I think everyone should have, including male, female. Why? Because sometimes you have to guide your spouse, on how to make it much more pleasurable for both of you, right? I don't know, but I am a fan of that. I believe that sexual interaction or sexual activity between spouse, between couples, it has to be a team work. That is my belief. I don't know about any other person. Some people feel that it is a man's thing. It is a man's thing. So the man is the one that should source or that should figure out how to start the process. A man should be the one to figure out how to, you know, carry the process up till the last stage. But I don't stand with that, okay? My belief is you have to, you have to work as a team, okay? You have to work as a team. What this means is per time, per season, at every point in time, you should ask your wife, you should ask your spouse, you should ask your husband, I hope this is okay with you. I hope this is okay with you. Some people feels it is weird. I don't know the reason why they feel it is weird. Because there is no how you know what I want per time. Because you're not me and I am not you, of course. If you're joining, you can let us know where you're joining from. And of course, if you have questions with regards or with relations to sexuality, you can drop your questions. I am here to answer your questions and of course give you clarity on every matter with relations to sexuality. Okay. So back to what I was saying. So now I don't know why people think that, you know, sexual activity has to be the responsibility, the heavy weight of figuring out how to start and up to the point of finishing. It has the weight has to be on the man. It does not make sense. So, like I stated earlier, I am Nurse Kamsi Nama, and this is Sexuality and Health Wellness. We discuss matters with relations to sexuality, with relations to health, wellness, and of course, we leave no crumbs behind. Clock it. Okay, so we're gonna be looking at some questions. Okay, we're gonna be looking at some questions, and if you have questions, so I'm gonna be ransacking some questions I have here, and kind of discuss it here, so that people can have clear understanding of what certain sexual or sexuality topic is all about or entails, and not make or be confused about some matters, so that some in the days that your opinion is needed about a particular thing, you are able to give it, including to your children, right, including to your spouse. You're able to say no when you should say no. Yes, it is not everything that you say yes to, right? Okay, so here we have a question to look at, and one of the question is number one. So if you have, for people that are on the live, if you have questions, you can actually drop it, okay? You can actually drop it and we can also take it from there. But here we are going to be looking at a question here. And the question is, what do you think as a nurse? What do you think about, or how do you see um, anal sex? What do you think of anal sex, or how do you perceive anal sex? Can actually paraphrase the question like that. So here is the drill. Drum rolls. Here is the drill. Now, I know many people have controversies about different, different sexual activity, quote unquote sexual activity, okay? Because when we say sexual activity, it covers different angle and different spheres, but we can actually single them out. And now one of them is the question now, what do I think as a nurse? Thank God the person said as a nurse. So I'll have to talk in the medical, through the medical line, because if the person said as Kamsi, what do you think? I will say it from my own standpoint, and maybe YouTube may be shaking by the time I'm done. But let's hold ourselves together, pull ourselves together. Okay, now basically, when we talk about anal sex, what we look at is penetration of the penis through the anus, right? Through the anus. Now, of course, we know that this practice is not only seen in gay people, all right? So if you think this practice is only seen in gay men, then just debunk that. This practice is also seen in married couples, that's male and female, okay? In the male and female gender, married couple. So you find out, I had this guy some time ago. The guy said to me that, ah, I have I have this thing, this desire inside of me. I was like, oh, okay, you can share it. I want to, I'm very inquisitive. I am very inquisitive. The guy said, I have this desire inside of me. I said, oh, okay, share with me. I'd love to learn of this desire of yours. He said, I think I prefer anal sex. I was like, okay, why did you say that? So the guy went on to say that the reason why I said this is because I know so well that if you're just joining, you can drop your questions. This is Sexuality and Health Wellness, okay? And I am Nurse Kamsi Nama. So hello, Mokoena. I can see you, Mokoena. How are you doing? So this is sexuality and health wellness. What we talk about here is issues regarding sexuality. And of course, you can drop any question. But currently, I am answering a question. Okay. Good to know, Mokoena. Good to know. Oh, let us know where you're chatting from. Okay, let us know where you're chatting from. Okay, so I the guy went on to I'm answering a question. Okay, for people just joining us, I'm answering a question. Okay, nice meeting you, Mokoena. I'm answering a question, and the question is yes, I'm also from Nigeria. The question is, why is it, or from my perspective, what do I think of anal sex as a nurse? What do I think of anal sex? And I already started answering the question not long before some other people joined in, so just for us to tune in and be in synchrony, right? So there is this guy that he told me I have this desire, and I was like, what desire are you talking about? I'd love to learn of this new desire of yours. I'm that kind of person that is inquisitive, like I stated earlier. So he said that, I don't know, but I think I prefer anal sex. I said, oh, you mean you're gay? He said, no, 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 he's not gay, but he'd love a situation where when he's married to his wife, he'd practice anal sex with the wife. So this is just for us to know that anal sex is not a gay something. That's number one. Okay. So when the guy said this, I was like, I said, okay. I asked him why. Okay, thank you, Mokoena. Thank you very much. I asked him why, because I'd love to see people's perspective on matters with regards to sexuality. If you come around me and you tell me that lesbianism is nice, I won't pursue you. No, I will not be like, get out of me, all you workers of iniquity. No, 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 I don't. No, that's not it. So I try as much as possible to do my research. Okay, so I start with you that have already pronounced that, see what you feel comfortable with. So I asked him, okay, why do you think this is nice for you? Like, why do you think you're gonna enjoy it? Then the guy went on to say that I think I'm gonna enjoy it because entrance penetration or penile penetration through the vagina is loose. I was like, oh, really? He said yes. And that he thinks that from the anus, it's going to be tighter. I looked at him, I said, I said, okay, okay. I said, okay. But now, here is the drill. If I'm going to answer this question as a nurse, we're going to start with number one, the anatomical structure of these anus that we're talking about. Now, if I believe all of us joining this life, we are humans. So, of course, you've got your anus, right? If you're going to spend some minutes someday and do just a general a general observation. Now, the reason why I'm putting this out here is not because the people joining the live show are gay, no, but because you need this knowledge to address certain things in future time to come. You're gonna have children in time to come, and you're gonna teach them. All right, Mokoena. All right, you're going to teach them some time to come. You're going to have children. You're going to come in contact with some people that have different view or different perspective about this matter we're talking about now. And you're going to have to teach them. You're going to have to give them your perspective. And you're going to make sure that your perspective is coming from the standpoint of someone who knows what he is saying or she is saying. So back to what we're talking about, right? Back to what we're talking about. So if we're going to look at the anatomy of the anus, we're going to look at the anatomy of the anus, we find out that the anus is made up of this type of skin, and of course the direction and the projection of this skin of the anus is towards it's directed towards the outside. I'm trying to sound as lay as possible, the layman's language, right? So that everyone understands. So the anal canal is positioned in kind of an outlet manner. So it is an outlet structure, not an inlet structure. If you understand what I am saying, if you understand what I am saying. So it is kind of an outlet structure, not an inlet structure. So if at all we find out, let me cite this example. Now we have just like the eyes, right? The eyes, you don't put things in the eyes, right? Or basically, there are certain things you use for your eyes that you shouldn't be using for your mouth or for your ear. Okay? There are certain things you use for your ear that you should not be using for your nostrils. Okay? So in a situation where you start using something for that, something that you're not supposed to use for your eyes, you start using it for your eyes, what is going to happen? Of course, you're going to experience damage of the eyes or of that part of the body that shouldn't experience that ugly experience. So that is the same thing. So when people talk about anal sex, they talk about anal sex. They must understand that number one, the skin of the anus is totally different. Okay? And the skin of the anus majorly supports outlet and not inlet. That is the reason why your anus excretes, your anus pushes out undigested food particles. It can easily do that, right? It can easily do that. Now, for other procedures that we carry out in medical lines, for example, if I want to insert a fletus tube, okay, so that you hello, Mayuri De Burma. I don't know if I pronounced the name correctly, but I can see you. Hi. Hi. So if I want to, yes, for people joining us, this is Sexuality and Health Wellness. Of course, the name already shows that we are talking about matters with relations to sexuality. And today we're answering a question about anal sex. Is it right? How do I perceive it as a nurse? And that's what I'm trying to debunk here. And of course, you need the knowledge because it's not just about you, it's about you and people that come across, or you come across, people that come around you, and people that you come across, right? So, back to what I was saying. Now, if I want to pass a flatus tube into the anus of my patient, because the flatus tube goes into the anus, yes, and the enema tube goes into the anus. And the reason why we use them is for medical purposes. Okay, so I just want to prove to us that the anus is not an inlet structure. It's not a structure that takes in other structures or that takes in stuffs. It is a structure that lets out. It's an outlet structure. Okay, so if I want to pass an enema tube, the first thing I do is I have to lubricate it. As a nurse, I have to lubricate it, put on my gloves, and then tell my patient. Now, listen, tell my patient to, at insertion of the tube, I will tell my patient to cough, to cough. Now, the reason why my patient has to cough is because naturally, if I have to just put it in just that way, there's going to be a lot of resistance. There's going to be a lot of resistance, even with the lubricant. Okay. So by the time the patient coughs, if you don't know, you can practice it now. Cough, and you find out that coughing has this effect to your anus. Okay. So it's by the time the patient coughs, it kind of open up the orifice, the anal orifice, or makes it a little bit relaxed, right? A little bit relaxed. And therefore, the resistance lowers or lessens, and I'm able to pass my enema tube or pass the flattish tube and get the procedure done and dusted. All right. So, what I'm trying to say is, apart, even in the practice of some procedures, We know that the anus is not an inlet structure. The anus is an outlet structure. For people joining us just right now, you are welcome. And this is Sexuality and Health Wellness. And of course, with the name, you know that we talk about issues with relations to sexuality. And this is about anal sex. What a nurse thinks about, what the nurse thinks about anal sex. Okay. So now listen, back to what I was saying. For people that practice anal sex, it means there is continual, see what the problem is. There is continual penetration. That means there is continual inlet. There is continual inlet of a substance or a structure into the anal canal. And because of this, the tissues or the skin of the anus, the tissue of the anus or the skin of the anus can easily get irritated. Yes, can easily get irritated. And at that irritation, we can such person can experience such person can experience accident like micro tears, like anal fistula. If you're joining just now, welcome. This is Sexuality and Health Wellness. We're talking about issues with relations to sexuality. And we're answering a question just right now about the anal canal. We're answering a question what the nurse thinks about anal sex. Okay. So now, in that case, there is continual inlet, that is penetration of the penis into the anus, and this is going to strongly pull on. Now listen, it's going to strongly pull on the skin of the anal canal. It is going to strongly pull on the skin, on the tissues surrounding that the anal canal is made up of. And in that picture, in that scenario, what we're going to end up with is a situation where the tissues of the anal canal can get saggy. Now, this is with relations to how often this person have been exposed to this, and of course, the intensity, the frequency, and the speed of penetration. For those joining us, this is Sexuality and Health Wellness. We're talking about issues with relations to sexuality, and we're answering the question: what does the nurse thinks about anal canal or anal sex? Sorry, anal sex. What does the nurse think about anal sex? So we have answered the question up to a particular extent. You can of course subscribe to the channel to go back and watch this video over and over and over again. All right, so back to what I was saying. So the motion that we the motion that is experienced, or the motion that is carried out or practiced during anal sex, it requires continuous continuous inlet and outlet, inlet and outlet. Why? Because it is penetration, right? We're talking about penetration here. So we find out that there is continuous inlet and outlet. That is penetration, right? Thrusting. So in that scenario, it is going to drag on the tissues of the anal canal. And of course, this is depending on the intensity, the speed, and the frequency, just like I stated earlier. So in a situation where this person in question is using high speed, high intensity, and of course, high frequency to penetrate through the anal canal. Hi, Joshua Funny Bay. Hi, I can see you. Hi. It's nice having you. This is Sexuality and Health Wellness. Okay, we're answering a question: what does the nurse think about anal sex? And of course, this knowledge is not just for you, it's also for you, for people around you, for your children growing up. You can let them know, because as time goes on, people, there are going to be some lies out there telling you that the reason is because it is important, it is advantageous because of this and that. But when you have the accurate knowledge, you're able to you're able to push aside certain lies. That's the truth. So back to what I was saying. Now, there is high possibility of the tissues surrounding the anal canal to eventually, as time goes on, to sag. Yes, to sag. That's number one. Number two, there is high possibility for micro tearing. So we'll have that's when we see situations where people are bleeding from. Okay, so sorry for the break in transmission. Okay, all right. So back to what I was we had an issue here. Back to what I was saying. Sorry for the break in transmission. I'm so sorry for the break in transmission. Sorry for the break in transmission. Okay, so back to what I was saying. So that is when we have in situations like this, we have some people experiencing bleeding from the anus. Yes. I remember when I was in secondary school. When I was in secondary school, there is this barbing salon. Okay, yeah, well, that's how we call it. There is this barber shop. There is there used to be this barber shop. I don't know if it's still there. So there used to be this barber shop where um we were advised. In fact, boys we are told don't go there, especially when you don't see anyone in there barbing hair. In fact, even if you want to barb your hair, be very careful. Going in there to barb your hair is a risk. That was what we heard that time. So we never knew the reason why until one day. Until one day, a guy was said to have been raped in there. I was like, what? Raped? How? So we got a full gist. We were told that the guy went into the barbing salon. He was called. So he went into the barbing salon with hope that this is guy. This is a guy. And you know that guys are fond of, hi, Mr. Sliper Mask. I can see you. I can see you. So this guy went, oh, hi, Bumiputra. I can see you. Hi. Hey, Bumiputra. The last time I was waiting for your question yesterday, I was waiting for your question. I didn't get your question after the whole thing. I don't know. You can try dropping the question today, okay? So the guy was narrating from his end, right? So the guy was like, he was on his way back from school, and of course, that road leads to his house. So he was on his way back from school, and this guy called him alpha guy come. And you know that one thing about guys are, cool with themselves. They play around and all that. So even if you're a guy that I've never seen in my entire life, when you call me, I'll answer you. And well, I'll answer is as if we have been friends for ages. I don't know, that's how I see it around here. So that's how it was. So the guy went with that courage, and that's, it's a guy, he's a guy, and he's my G. So he went there and shook hands with the guy and was like, how are you, how are things going? I hope you're fine, I hope you're good, and all that. And after the whole exchange in greetings and all that, the guy was like, come in, I want to show you something. And from coming, I want to show you something, the guy was molested. It's I don't know, but the guy was molested. The guy was totally molested. Like, yeah. So this barber guy took advantage of the boy. So they know the kind of people that they actually grab and get hold of. People that obviously cannot fight for themselves and they are obviously stronger than. So it was because the barber shop was, kind of tinted, the glass tinted and all that, and all that. So you wouldn't know if something is happening inside. You wouldn't really know if something is happening inside, especially when the generator is on, making noise, and somebody is inside, locked the glass tinted door, and having his way with some guy, taking advantage of a fellow guy. It's totally crazy. It's totally crazy. So the thing was that it was later people found out they really beat that man black and blue. Yes, they did. But the thing is this: the guy was said to be bleeding from the anus. So I'm just trying to give a valid, real, actual occurrence of what tear or micro tear can actually result to when people engage in anal sex, right? Okay, and this is not limited to men. This is for men. This is also for women. All right. So I also had a patient. I think that was last 2 years. I had a patient. This patient walked in, and is a guy. He walked in presenting with the guy walked in presented with a foul smell. Okay, a very foul smell. And remember what I said about saggy tissues. Remember what I said about saggy tissues. If you're just joining us and you'd love to gather more information about what we're talking about, you can go back and just reverse the video and see or understand the full entirety of this video. Okay, so of this live chat or of this live video. So back to what I was saying. I had this patient 2 years ago, 2 years, last 2 years, and the patient presented with foul smell, odor from every end. I said, Lord, how do we do this? Nurses have seen a lot. Nurses see a lot. Why? Because the doctor just come in, they prescribe drugs, and then they run for their dear lives. But we nurses, if you are smelling, if you are stinky, yeah, I'm saying this like from a place. I'm not trying to insult, all right? I'm not trying to sound, bad or inconsiderate. No, I'm trying to be real because this is what it is like. So if you're smelly, if you're stinky, if you don't bathe well, if you're dirty, dirty, if you're dirty, and you come to the hospital, we still receive you the way you are. And you know what? The patients have to stay with the nurses. So we stay with you no matter what, regardless of what. We stay with you. And of course, we love you the way you are. Trust me, we do. So this guy was stinky, like smelly. So he came in, we took it from there, got history about the guy, and then we took it from there. And do you know what the guy had? The guy had anal fistula. What does it mean? It means when there is an opening. When there is an opening. Now, the opening may be from, it may be just a little, maybe much. And if there is an opening, that means there is or been, there is or there have been, whether slight or severe tear or severance of the tissue of the anal canal. So now we can have your undigested product that's supposed to come out as feces, we can have them lodged into these places that there is tears, micro tears, or severe tears. And you know what it means again? It means this person is out. In fact, this person is at risk for septicemia. What is septicemia? Septicemia is simply infection of the blood. Okay, infection of the blood. So when that man came, we had to treat him for septicemia. We had to also take care of we had to also take care of the wound in the anal canal so that it heals up, and we stop perceiving those odor. Okay, so but basically, what am I trying to say? People that engage in anal sex, they are really down for a lot of things. In fact, according to, because the question is, as a nurse, what do you think of anal sex? And I am answering as a nurse. If you had said as without the nurse, that's me without the nurse. In fact, I would even answer it in a very well. Let's not go there. But back to what we were saying. Now, now, if you are to really reason it as a nurse, hmm, or as a medical personnel, if an activity, any activity that you are going to practice, see, I'm raising my voice because it is serious now, it's getting serious. Any activity you're going to practice that does not benefit you as much as it is going to cause you some disadvantage, I think it is high time you left such activity. Hmm. Yes. So if you're going to practice anal sex, and anal sex promises to make you pay dearly, as if you're paying for your sins and the sins of your ancestors, and of course the sins of your forefathers and great grandfathers. Forefathers is more than great grandfather, right? So forefathers, and this activity is going to make you look as if you're paying for the sins of your forefathers. Medically, we don't encourage such activity. Okay, we don't encourage such activity because your life is at risk, your health is at risk, and you're going to be coming into the emergency like almost every now and then, and we're going to be taking it from there like almost every now and then. Does not make sense. So instead of you to keep at it, keep going, having sexual anal sex, and coming, maybe a week in, week out, you're in the hospital, week in, week out, you're in the hospital, and we keep running around because of you. Why don't you, just try as much as possible and work on that desire? Okay, work on the desire, and let's stick to the penis to vagina, or penis in the vaginal sex, and leave the anal sex. It's gonna benefit people that do that a lot. Okay, the penis in the vagina is gonna benefit you much more than the anal sex benefits you. The anal sex exposes the people that practice it to different potential diseases, to different risks, and it is a no if we are really talking about from the medical aspect or the medical angle. All right, okay, so that is it for the anal sex. If I'm going to answer as a nurse, that is how I would answer. That is my answer if I were gonna answer, or if I should answer as a nurse, a medical personnel, a nurse. So if you're joining and you have other questions, you have questions on sexuality, you can drop your questions on sexuality, and I am here to answer you. What I do is I give answer for a living. I answer your questions for a living. Okay, that's not true. Okay, but if you got questions on sexuality, drop your questions and I will attend to them. Okay. I don't know if Bumi Putra is there and she still got her question to answer to. Okay, Bumi Putra asked a question. What is fissure? Fissure is more like an opening. Are you there? Okay. Fissure is more like an opening. All right. It is more like an opening. So basically, your body is created in such a way, even your blood vessels. Now, I used to think like that blood is just everywhere in my body. Like once you cut open my body, you see blood everywhere. No, there are places in your body that blood vessels do not line. In other words, every structure in your body has its own compartment and has what separates it from any other or every other compartment or every other structure. If any structure in your body is communicating with other structures that it should not be communicating with, then that is an error. And that can lead to serious problems. What do I mean? Fissure is just like an opening in a tissue in a particular body part. We also have vesico-vaginal fistula. We have vaginal fistula. We have we also have recto-vaginal fistula. Okay, but let's not deviate. Fissure is an opening. So in a situation where the anus has even a slight opening, that means the tissue of the anus have been severed. And if the tissue of the anus have been severed, some structures have also been breached. And if these structures have been breached, it simply means that we're going to have situations where undigested food, of which, remember, undigested food coming from the large intestine, heading down to the rectum, down to the anal canal, heading down, these undigested particles or undigested stuff has bacteria in them. Yes, because bacteria is the reason why. These bacteria are the reason why when you poo, when you go to the toilet, when you poop, your feces, your poo have this distinct smell, odor. Then we're like, why are you doing that? Close the door, shut the door, flush the toilet. Do you understand? So these bacteria will eventually have to interact with some structure that its compartment have already been breached. So there is possibility for infection to be introduced to those compartments, that because in as much as your anus is concerned, your anus still have blood vessels running and lined through it. So imagine if it was the blood vessel that was breached. There was a fissure and the blood vessel was breached. It means the bacteria that are found in feces will seamlessly, with easily travel into the bloodstream. And do you know what it means? Because every blood that is captured in a blood vessel finds its way to the heart eventually. Yes, find its way to the heart. That is the reason why oxygen is circulated around your body through the blood. Yes, not because you breathe in like this. And I say, oh, my body is filled with oxygen. It's a lie. Your lungs are filled with air, and your lungs begin to process this air to oxygen, separate the carbon dioxide, separate the oxygen, send the oxygen to where it should be sent. And of course, the oxygen makes interaction with other cells of your body or other tissues in your body through the blood. So imagine if this blood is carrying bacteria and the blood is majestically heading back to the heart. Do you know what it means? Infection of the highest order, loading. Infection of primary, is it primary? I don't know. Infection of the highest order, like chiefly loading. And do you know what else it means? Septicemia is a situation whereby your system, your whole system is having or is under severe infection. And you may think that infection is not infection. Drink antibiotics. Oh, really? Oh, is that what you think? Septicemia is the highest form and highest level of infection, and it is systemic infection. That means your heart becomes infected, your lungs, every part of your body is battling, seriously battling with infection. So now, what do you think will happen? So, but that is what fissure is. I actually took it a little bit, Indeed. I don't know. I have a way of elaborating so much on particular answering questions. I have a way of elaborating so much. I don't know if it is a very good thing or if it is not a good thing. I don't know. But that is me for you, right? Just know me and know peace. That is all. But yes, that is basically what fissure is, and the things I stated afterwards is what fissure and anal fissure can actually result to. Okay, so other questions can actually come in. Other questions can come in, and I'll be very glad to answer them. Okay, Bumi Putra, if you're still there, have I answered your question? Do you think I've answered your question? Let me know, Bumi Putra. If I have answered your question, you can let me know. Okay. All right. Can just let me know. All right. Thank you for asking, and of course, you got your answer. So other questions can actually come in, and you see if you can call it a day. See if you can call it a moment with the live chat family. Okay. Other questions can jump right in. Okay. Other questions can jump right in. See if I got the question here that I need to answer. Okay. Let me see if I have a question here as well. Mm-mm. Okay. All right. Okay. So we have a question. We have a question. We have a question. So for people that are just joining, this is Sexuality and Health Wellness. I am Nurse Kamsi Onoma. You can as well subscribe to follow up with subsequent activities in this channel or on this channel. All right. Basically, my answer to this question is gonna sound a little weird, but yeah, that is it. So here is a question about another form or another type of sex, the oral sex. What do I think about the oral sex? Okay. Um now, well, listen, we have to um we have to like say divide, not divide. We have to classify. Yeah, I think that's the word. Classify. Number one, you have to understand that oral sex is of two main classes. Number one is the cunnilingus, and number two is the fellatio. The cunnilingus and the fellatio. The cunnilingus and the fellatio. Okay? The cunnilingus and the fellatio. All right? So now, what is the cunnilingus? The cunnilingus is basically situations or that period where you see a man, or where the man is having his time with his face and his mouth in the vagina of a woman. Yes. So I don't know. Okay. Then the fellatio is when a woman, or let me put it this way, penis in the mouth. Yes. So the cunnilingus is the vagina in the mouth. Then the fellatio is the penis in the mouth. Okay, so now I'm going to debunk this myth. Okay, so here now, the cunnilingus is not as beneficial as the fellatio. Now I know you raise a brow and be like, what do you mean? Are you trying to say that penis in the mouth is beneficial? Well, yeah. So don't be in a hurry to, you know, scream. What do you mean? Chill. Now, how is that so? Does that even make sense? What do you mean by that? I'll tell you. Now, number one is we'll have to ascertain if we'll have to ascertain if the person in question, that means the person that the penis is in their mouth or in his mouth or in her mouth, let's say his. Well, in this case and in this time and in this season, there is gay people. So in their mouth, does this person or is this person willing to swallow or spit out? That means in a situation where there is ejaculate from the activity, is this person willing to swallow the ejaculate, that's the sperm, or spit it out or discard it, or the person pulls out their mouth when the ejaculate is almost out there? So that is another question. Now, if the person is willing to swallow the ejaculate, then that is where the benefit majorly lies. Okay. And now, disclaimer here, this video is not so as to motivate you to go about having oral sex. Be careful, okay? Because oral sex can actually land people into many trouble, because a lot of people think that oral sex is one of those ways to do family planning because you don't get pregnant when you do oral sex. But the truth of the matter is, yeah, you don't get pregnant, but you can actually get HPV and then be a candidate of you know, cancer, throat cancer, larynx, you know, cancer generally. Okay, let me just put it that way, cancer. Okay, esophageal cancer and whatever you can think of. But back to what I was saying, I don't want to deviate. Okay, so if this person is willing to swallow or wants to swallow or is okay with swallowing, then it simply means the person is going to take in the sperm. And one thing about sperm that many people don't even know or many people don't even talk about is sperm is very rich. Sperm is very rich in protein. Very, very rich in protein. So people that swallow sperm, they are not just enjoying or they're not just having the sexual pleasure, they're having the sexual pleasure and of course they're having balanced diets. Okay, it sounds weird me saying that. It's supposed to sound funny. Okay, but back to what I was saying. Of course, that does not mean that that does not mean that that is actually the only thing, okay, about fellatio. That is the only thing about fellatio, right? And that does not mean that you don't get your nutrients from eating the adequate food. But of course, I just have to state fact the way they are, and this is the reason why fellatio is advantageous, is beneficial. Exactly. So now, another question here. Another question here. Is it right to do some to carry out some sexual activity like the oral sex you spoke about? Okay. Is it right to carry out some activity just like the oral sex you spoke about? Or is it wrong? Now, I said something earlier when I was talking about anal sex. I said that according to or judging from the medical aspect or the medical line, one of the things that we look at is this thing, does it have potential of harming you or harming your spouse? Not necessarily you, but you or your spouse. If it does, I don't think you should be practicing it. You should not be practicing it. If it's going to cause you harm, if it's going to cause you, it's going to hurt you, it's going to hurt your wife, it's going to hurt your husband, you shouldn't be giving it a try. You shouldn't be considering it, right? So that is number one. Now, in other scenarios, apart from the thing that's going to cause you harm and then you scrape it off, other scenarios, well, if it is right and beneficial and whatever you may think it is, just like some people that feel missionary style is the only way that people should assume, the only position that people should assume during sexual intercourse. Now, that is that is as a result of, I believe that is as a result of over time, the people from the past ages, giving us that drill that this is it, this is it. And then a lot of people also, religious concerns about this matter, and of course religious how will I put it? Contribution, yes, religious contribution. But the truth is this: if it's not going to cost you harm or your spouse harm, then yeah, you can actually give it a try. You can give it a try. And if you are not settled, whether in your spirit, as a Christian, as whatever religion you may be from, if you are not settled, if you, this is a sin, this feels like a sin, then stop it. Yes, because naturally or originally, well, generally, you're being hurt. Your emotions are being hurt. You are not settled. Your mental state is hurt. So, in as much as physically you don't really have anything against it because your body totally adapts to it. Probably your body is not protesting, your body is okay with it. But your psychology, your mind, you're having a lot of quarrel, a lot of conflict in your mind, then you have to stop. You have to stop. You're gonna risk the health of your mental, your mind, your brain, your mental health. You're gonna risk that health. So for you to make sure that you're doing certain things, and of course, these things, hi Satis Harolka, nice seeing you, Satis Harolka. So some people they just want to do things because others are doing it. They just want to do things because, well, I don't know what he will say. Well, I don't know what she will say. Well, let me just do it. I don't know, but let me just. I just feel somehow every moment after I'm done with this, but well, let me just do it. If you feel that way, then you are torturing yourself, and of course, that is also considered you not being okay with it. That is also considered as you doing things because you have been forced to do it. You're doing things because you are not really, your body, your spirit, your soul, your mind is not in synchrony with it, but you just have to do it because I guess everyone is doing it, or I guess I just have to do it because I have to please this person. It doesn't work that way, because if you're gonna get hot, or if you get hot, that is you and that is all. Okay, so I hope that and every other thing I said is clear. If you have any more questions, you can drop before we call it an afternoon. So I really hope we guys got a lot of something today, because I've been putting my back in this. I hope you guys got a lot of wonderful stuffs, from today's live session. I was actually off duty, so I felt it's kind of boring here. I don't want to sleep yet, so let me just jump into the live video and just do something. Okay, so let me know if you have other questions to ask. Really love to answer. Okay, I really really love to answer. Okay, all right. Okay, so far so good. We're able to iron out about 3 to 4 questions, massive and major, like yeah, three of them are major questions, need a lot of clarity on them. So glad I was able to iron them out. I was able to present them to us all, and that is that. All right guys, I'll see you all in my next live video or live chat. Ciao.